The United States continues to lead the world in the most number of COVID-19 cases. Nationwide, as infection rates climb, California, Texas, Minnesota, Ohio, and Florida are the states with the most new cases. New York is faring far better than others, but today, some stern warnings.
Really bad news, family gatherings and smaller social gatherings have exploded as places where the virus is spreading.
According to state health officials, 65% of the state's COVID spread stems from these gatherings. It is why state and city officials are standing by, waiting to see how New Yorkers' Thanksgiving plans will play into infection rates here. The state of our hospitals is now taking top priority. From the end of June to today, hospitalization rates are increasing dramatically.
We are seeing the rise in hospitalizations all across the state.
Even during a holiday weekend, the governor, at the urging of his own health commissioner, spoke with leaders across the state, including Mayor Bill de Blasio, all appearing today to be in agreement over new measures surrounding hospitals, both private and public. Hospitalization rates over a 3-day average will now play a role in determining red, orange, or yellow zones. Beginning today, hospital systems will need to balance their patient population between all hospitals in their system. This, the governor says, would ensure no one hospital is overwhelmed should a patient surge come, much like we saw in the spring at Elmhurst Hospital.
No patient wants to be in an overwhelmed hospital because you're getting less care, the staff is stretched thin. We're not going to live through the nightmare of overwhelmed hospitals again.
Hospitals will also have to identify its retired doctors and nurses now. Nearly 30,000 volunteers arrived from out of state at the peak of the pandemic. As the coronavirus bears down on nearly every state, this time around, pulling reserves from other locations won't be likely. Also among the governor's measures are preparations for field hospitals, as well as increasing hospital capacity by 50%. 90-day supply of PPE is also of top concern. The state's health commissioner assuring us that oversight is occurring on a near daily basis. From Midtown, Narmeen Chaudhry, Pix 11 News.